So
So
that
will be.
I want to go up and help her
Oh, yes,
celebrate.
of course. So there will be official inauguration for Professor
Yes,
D
the way they do it is
on the EV.
at the close of the business meeting, he gets to hammer the gavel and to close the meeting.
Yeah,
So
yeah.
that's where the transition happens.
Oh, yeah. So who will be the next president-elect?
I think it may be Robert Hester.
Yeah.
Yes, he does a lot of the modeling that's used in teaching.
Oh, yes. Yeah. Oh, glad that I choose him.
Yes.
I choose him because his track record. Yes, he's very close to the education.
And he was actually a graduate student when I was a postdoctoral fellow down in Mississippi. So I've known him for 40 years now.
Wow. Yeah, he's very good with that. By the way, regarding to our proposal to you to be our adjunct professor, that our proposal already received by the president of university, the rector, and the rector has already agreed, and then it is still in administrative process for the official appointed by the president of the university. The letter is still in process.
Wonderful.
Now. Yeah.
Very pleased to be invited.
Yes, thank you. So for the reason that maybe I will ask you to teach us for several program, not only for this undergraduate program, but also for our postgraduate program. We have a Master of Biomedical Science, and we are now reorganize the curriculum, focus on the functional medicine, and of course, one of the material is about the aging process.
Yes.
So I hope that you will give a regular lecture to our student for aging, for postgraduate student. And also we have a doctorate program for biomedical science, and I will ask you also to give the lecture. I think same thing is about aging, and also additional topic about how to publish our research. Yeah, because now you are the second professor, adjunct professor in our faculty now. The first one is Prof. Nori Faibuchi, and he already gave the regular lecture to our student.
Wonderful. It's a great opportunity to bring in different experiences to your school.
Yeah, thank you very much for your willingness. Professor, that we also have a participant from postgraduate program of obstetric and gynecology that I just called, that got a call from the head of the department, Dr. Ferry, that he want that special student also want to join with your lecture this morning. It is okay for you?
Oh, most certainly. No more effort on my part.
Yeah, thank you. And the moderator will be Dr. Raisa. Right? Dr. Raisa is the obstetric gynecologist.
Very good.
Yeah. Siapa aja yang udah datang, Raisa? Oh yeah. Okay. Prof Hardy. Prof Hardy. How are you,
Thank
Prof
you.
Hardy?
Selamat pagi, Prof Hardy.
Selamat pagi, selamat malam. Selamat malam, Prof. Robert Carroll. Nice to meet you.
Dr. Carroll already joined.
Oh, okay, of course.
And Dr. Siva.
Okay.
Can we start?
No. We have to
finish?
start. We have to start at exactly
Okay.
8 o'clock. So how about the COVID now in Caroline? Rob.
Yes, not nearly as good as the Indonesian coffees.
But is it already flat now, the cases?
Yes.
Oh,
okay. We're hopeful that we will not have the bump up that Europe saw. Usually we run about 2 weeks behind Europe.
Yes. Good. 2 weeks behind Europe.
But so far, there's not been the increase in cases around here.
Good one. And US is 2 weeks behind Europe, and Indonesia is 1 month behind US. How about the death case is increased because of the Omicron, or
no?
Not too.
The death rate is actually stayed very low. So between the vaccinations and the people who are behaving, wearing masks, I've got my mask also with me.
Yes.
Hopefully we can stay ahead of it.
Yes, of course. I hope that still under me. Rob, that I want you to give a question after the lecture that must be answered by the students. Yeah, and the best answer we have already provide a present or for the best answer that you choose. Yeah, 1 book from our department.
So this should be an essay question, or yes?
Essay question, and you can choose the best one, the best answer for that.
Good.
Because last Saturday, also D already gave the question also, and she chose the best answer.
Start the session, Prof. Assalamualaikum.
We can start.
Good morning, Prof. Carroll. Thank you very much for joining us today. It's such an honor for us to have you here and learn directly from you about aging. Good morning to our professor, our Dean of Academic Affairs, Dr. Irfanuddin, our lecturer and faculty members of Sriwijaya University, and also our beloved students. Welcome to the last session of Insightful Moments with World Class Professor 2022. They say save the best for the last. So my name is Raisa Nurwani, and I'm one of the physiology teachers in Sriwijaya University, and I'm your moderator today. Before we begin, I have a few notes for the participant. The first one is today's session will last 120 minutes, including questions and answer session. So we will end this session at 10 a.m. Question and answer session will begin after the presentation. Prof will give one question, and the best answer will get this book. And then after that, you can ask questions to Prof. This meeting is currently streaming on our YouTube channel, and a recorded versions of the session will be available on our YouTube at Physiology of Aging. We are privileged to have Prof. Robert G. Carroll, PhD, who is a professor of physiology and associate dean of Brody Medical School, East Carolina University, United States. And Prof. Rob also a chair of Education Committee of International Union of Physiological Science. And today's topic is Physiology of Aging. We know that no one can stop aging, but we hope by the end of this lecture, we can know more about aging so we and our patient can age gracefully. Without further ado, I would like to welcome Prof. Robert Carroll to deliver the presentation. To Prof. Rob, the screen and time is yours.
Thank you very much, Prof. Raisa. It's a great pleasure to provide this talk. I have a great fondness for Palembang and for my interactions with my colleagues over there. The topic of my talk is an aging physiologist. So as you look at the screen, you can see pictures of me over the last 68 years. I'm interested in this topic, not necessarily as an academic pursuit, but I'm getting older. So suddenly all of the things that we talk about have direct relevance to me in my daily life. As an introduction, I've been to I had the opportunity to visit my friend, Professor Irfan, along with a colleague from Taiwan, Mei-Ling Tsai, and also another visiting professor, Professor Nori Koibuchi. It's great to travel. It is great to have interactions with my colleagues around the world and to share insights that we each get from our experiences as we find ways to better improve the teaching and the lives for our students. One of the other things that I did was I'm interested in writing and publication. So I ran a faculty development workshop for the faculty on how to publish scientific research and putting things like that together. Because of COVID, we've not been able to share the interactions at the level that we had before. So although I'm not able to come down, the technology has enabled us to interact through the web. However, we've not yet found a way to accomplish the online eating. So the Pempek and the Krumpuk Udang will have to be saved for another opportunity to be with you. Take a look at this data. This graph, this table shows the mean arterial blood pressure as individuals go from age 1 through age 10. If an adult would show up with a blood pressure of 88/37, you would immediately begin resuscitation efforts. That's not a blood pressure that's desirable in an adult. However, for a 1-year-old child, that is a normal blood pressure. Over the first 10 years of life, the systolic pressure goes up gradually, the diastolic pressure goes up significantly as the child changes from the 1-year-old into a 10-year-old. Physiologists in general do a very poor job of explaining the changes that happen in the body with lifespan. Every time we talk about typical values, they're the values of a 70-kilogram male, and that's something I have not been since I was 16 years old. We also do a poor job talking about the differences between the sexes and the genders. So my talk today is going to focus on the changes in physiology that happen both with aging, and I'll make a point of separating out the impact of aging on males and females, because they're not the same. There are differences between how the sexes age. So take a moment and look at this question. For the students, figure out which answer you would like to have and talk to the people beside you and see where you come down. What do you think? When does a child's brain reach its adult size or mass? At what age?
Students who wants to answer can answer it by chat.
And unfortunately, with my setup, I cannot see what's put into the chat. So, Prof. Raisa, you'll have to tell me what information
Okay,
comes
Prof.
in.
No one answered it yet? Student? Please answer the questions. At what age does a child brain reach the adult size? One person answered E,
Okay.
1820. Another one answered B, 6 to 8 years. Another one answered C.
Okay.
So we have
a wide variety of possibilities.
Answer
Okay.
C,
Yeah,
A,
right.
B.
Right.
A.
So when you look at the right answer, it's actually B. As you plot out the brain, the teeth, the height, the body size, and the reproductive system, they mature at very different times. So when you look at how long it takes to get to the adult size, 100% of the adult size is when the individual has matured. For the brain, it happens somewhere in the 5 to 6 year range. However, when you look at teeth, the teeth don't reach a maturity until somewhere around the 10 to 12 years of age. The height, individuals reach their adult height somewhere around the 17 years of age, and the reproductive systems don't mature until around 20 years of age. Same thing with the body size. So when you look at lifespan and you look at aging, you have to be very specific as to what components you're talking about. For something like the brain, when you look at a child, a 2-year-old, a 4-year-old child, their head is massive. It's disproportionately large compared to the rest of their body. And even when you look at children's dolls, the dolls often have the very large head compared to the rest of the body, because they're trying to reflect the fact that this is a small child. Those proportions we've come to realize over as we grow up, those are the proportions that are characteristic of a small child. This next slide, still staying on the maturation, looks at the height velocity, which is shown in blue, the height velocity shown in purple, and the actual height attained, which is shown in blue. When you look at how quickly growth occurs from infancy to 2 years of age is the greatest rate of growth in an individual. You look at them, they will double their size within that window. If you consider that for an adult, if I would go from 200 centimeters to 400 centimeters, that doubling of size just doesn't happen when you get to mature. So the massive growth rate that happens early on flattens out during childhood, but then there's another growth spurt that happens around adolescence. For females, it happens a little earlier than males. And this growth spurt is caused by the reproductive hormones, and then the closure of the epiphyseal plates in the long bones is what helps set the final adult size. Because the growth plates in females close before males, the average height of women is usually less than the average height of males. So we have both the regular, there's no real difference in the growth rates between males and females until you get to the maturation of the reproductive organs. At that point, then you start getting a difference between the sexes. Another way to look at the lifespan, so we're starting from premature, a newborn, going all the way out to an adult male, is to look at their body composition. When you look at the premature and the newborn, their body composition is some 75% water. There's also, as part of that, there's a very large extracellular fluid volume, which decreases over that first year. There's very little adipose in the newborn child. The muscle mass is small in the newborn child, but then increases progressively as the individual ages. Once you get the influence of the sex hormones, then you get the very large increase in muscle mass. The organ weight as a percentage of the total body weight diminishes, but that's because the total body weight is increasing rather than the organ weight decreasing. The fact that the newborn has such a large fluid volume, and the fact that they turn over some 15% of their body fluid volume each day means things like dehydration or diarrhea is a life-threatening problem for children, where once you reach 20 years of age, diarrhea, some level of dehydration, adults are much more tolerant of it because we only turn over about 1/6 of our body weight, 1/16 of our body weight each day. So as you look at pediatrics is very heavily focused on what is the child's body weight, what is their hydration status, making sure that the infants do not become dehydrated. So we're now looking at the stages of life. The definition of adulthood is the attainment of a physiologically optimal integrated function. So we use that function in adulthood as the standard measure and refer everything else back to that 100%. It's incorrect to state that changes with aging are abnormal. They're just a different normal, much like the changes in blood pressure that happen as the child aged from 1 year of age to 10 years of age. There was nothing abnormal about that. For a 1-year-old, that was a normal blood pressure. Similarly, as we look at aging, you should not think about the changes that happen with aging as being abnormal. It's just the new normal for that individual. When you're looking at the elderly, there are 3 things to keep in mind. There's a bigger difference, it's a greater heterogeneity in the responses. The changes in function do not all occur simultaneously, so you will get some changes in function that precede other changes in function. And the changes in function do not occur to the same degree. So the one take-home message that I hope you remember from this talk is that old age should not be viewed as a disease, nor should you put a time clock on the aging process. As we look at the significance of human aging, gender is a very significant factor, but lifestyle is the primary factor. And there have been multiple theories of aging in order to explain the process. The bottom line is there is a disruption in homeostasis. Now, what is the importance of research in aging? How will that impact longevity? So this graph assumes that everybody is 50 years old, and then from that 50 years of age, how much additional lifespan do you have? So this orange bar is like today. A 50-year-old woman can be expected to live to the age of about 81. So they have about 31 more years of life left. When you look at these actuarial tables, if we were to cure all forms of cancer today, the average life expectancy would only go up by about 4 years. So if we completely eliminated cancer, we don't really change the life expectancy of humans. If we completely cured heart disease today, the average lifespan would go up by about 5 years. Even if you cured both cancer and heart disease today, the lifespan is only going to go up some 8 or 9 years. And if you throw diabetes, a cure for diabetes, then we're up to about 10 to 15 additional years of life. If we could figure a way to slow down the aging process, we could extend the lifespan out to about 110 to 120 years of age. So the significance of human aging in the aging research is this is what is currently setting the upper limits on human longevity. And as we better understand the aging process and how to accommodate it, we can greatly increase how long people will live. These 2 graphs split by women and men. They look at the average body mass index, the BMI, versus the height. I'll begin over here on the men's side. When you look at the BMI and this data is from the United States, at age 20, the BMI is somewhere between 24 and 25. As you pick up the decade beginning in the 30s, the BMI goes up about 1.5. Then when you get to 40 in the purple line, 50 in the blue line, and 60 in this washed out yellow line, there isn't really that much difference. So as you age, once you get up to about 40 for males, that's about the peak of their body mass index. The changes with age after that don't really occur much. There's also no impact of height. So if you look at somebody who's 160 centimeters tall versus someone who's 180 centimeters tall, there is no real difference in the age-related change in body mass index. In contrast, women show a very different profile. The profile at age 20 looks just like it does for males. As women age, their BMI increases, goes up when they're in their 30s, goes up even more when they're in their 40s, peaks when they're in their 50s, and then decreases once they get into their 60s. The other characteristic is these lines are not flat. These lines have a slope to them. So if you're 150 centimeters tall, the average BMI is going to be much higher for a woman as she ages than if you're 170 centimeters tall. So there is some impact of the starting height on the increase in BMI that accompanies aging in the United States. As we talk about the impact of aging, the major change throughout all organ systems is there's a loss of compliance. So going back to definitions, compliance is a change in volume over the change in pressure, delta V over delta P. And when you look at the heart, the biggest change in compliance is there's a stiffening of the ventricles. The ventricles do not relax as well as they do when you're in your 20s. Because of that, there's a decreased diastolic filling, and then that limits cardiac output in individuals as they age. For the blood vessels, atherosclerosis is a characteristic. The loss of the compliance in the vascular system means that you have a rise in the systolic pressure and the fall in the diastolic pressure, because the loss of that elastic tissue means that during ventricular ejection, the aorta is not able to stretch and store the energy. Then during diastole, the pressure falls much more rapidly because you did not store the energy in the aorta. So where normal blood pressure for a 20-year-old is 120 over 80, typical blood pressure for a 70-year-old may be 130 over 75. The mean pressures do not change, but the systolic pressure is higher and the diastolic pressure is lower. That same loss of compliance means that the lungs do not stretch as well as they do when you were 20 years old. So that means there's going to be a decrease in the breathing volumes. In the kidneys, there is an age-related loss in nephrons. That loss in nephrons accelerates as you age. For skeletal muscle, there's an atrophy of the skeletal muscle, and in the reproductive system, there's menopause and andropause, which is the loss of functioning reproductive capability in women and in men. Another consequence of age is that in contrast to most organs, which stop growing when they reach a certain size, the prostate continues to grow throughout life. So when you look at somebody who's 90 years of age, the prostate is much larger than it was when they were 70 years of age. and that can cause bladder outlet obstruction problems. Staying on the reproductive system, when you look at the first 3 months, the first year of life versus the first decade versus the remaining time of life, the plasma testosterone in males shows an increase during that first year of life, and then goes into a period of senescence where not much happens. Then once the males hit puberty, then there's a large increase in testosterone, which is maintained through adulthood. And finally, when an individual gets to be about 60 years of age, there's a gradual decline in testosterone. In the United States, there are a lot of people marketing drugs to try and say this drug will help keep your testosterone levels high as you age. The physiological impact of that is yet to be determined, whether or not that represents a true benefit or not. When you look at, for women, in utero, you have surges in FSH and LH. And then right after birth, during that first 6 months of life, you again still have an increase in FSH and LH, which then goes senescent until the female reaches the age of 10 to 14, at which point the FSH and the LH both begin to show the monthly surges that are tied to ovulation. Finally, by the age of 40 to 50, the ovaries stop responding to FSH and stop producing the estrogens and progesterone. And because of that, you lose the negative feedback on the hypothalamus, and the FSH and LH levels both increase. So after menopause, the individuals are characterized by high pituitary hormone, FSH and LH release, but relatively low estrogens and progesterones. Again, a lot of work is being done on estrogen replacement therapy to see what is the benefit, the long-term benefits and risks associated with that approach. As you age, there's a loss in the sensory system. So the age-related loss in vision is called presbyopia, and it's a loss of accommodation. So the near vision is impaired, and that's why you often see, as people age, they will rely on reading glasses because they've lost the ability to have the accommodation for near vision. There's also an age-related decrease in hearing called presbycusis. That hearing loss is also accelerated by aging. So artificial hearing aids are also more common in older people than they are in younger people. The decline in taste and smell begins at the age of 60 to 70. So very often you'll see older people shifting their dietary preferences to spicier foods, things that they will be using more spice in their cooking than they did when they were young. And there's also a decrease in somatic sensation, the response to touch, pressure, and to pain that accompanies aging. So all of those changes are not really a problem. The body has plenty of excess capacity. When you look at where the age-related changes are seen, it's in peak performance. The peak performance is diminished, but there's plenty of performance available for the activities of normal living. The physical conditioning seems to be driven by lifestyle choices, including stress management, exercise, and nutrition, as well as genetics and the environment. So this picture shows the United States actor Robert Redford when he was age 64. very good dietary habits, very good exercise habits. And I did not look like this when I was 20, so I certainly do not look like this when I'm 68. Stress management, exercise, and nutrition are all excellent ways in order to diminish the age-related loss of function. The current areas of research looking at aging, caloric restriction by far has the greatest promise. If you look at animals who are fed 80% of their ad libitum diet, so you cut down the amount of calories they would eat if they were freely allowed to choose their food, you cut that down by 20%, their lifespan increases dramatically. The type of foods ingested also impact the age-related functions. There's a role for insulin-like growth factor in the aging process, and a lot of work is being done on human growth hormone, other pharmaceuticals, in order to diminish the aging process. When you look at all of those approaches and look for commonalities, most, if not all of the things that enhance lifespan have a similar goal of targeting reactive oxygen species. So there seems to be a substantial role for oxidants in the aging process. As you look at on the internet, if you look how many times the words are hit, aging has almost 300 million hits. Anti-aging, even more. Google Scholar, look for aging in scientific papers, 4.5 million papers focus on aging. In the United States, there's a National Institutes of Health, and one of those institutes is the National Institute on Aging. That organization funded $3.5 billion in research grants in 2020. So that's the overview on aging. At this point, I'd like to shift the focus of the talk into the impact of aging on exercise performance. So take a moment and consider a 10-kilometer race. At what age does the performance for a 10K race for males begin to decline? So think about people you've seen running, people who are entering races, and what their performance is. You could talk with your classmates about this and see what answers you feel are for males.
Yes, student, you can answer it by write it in the chat. To all students, please. So answer B, Prof. The other answer
Okay.
D. C answer C.
Give us some time to get some answers in.
Most of them answer C.
So C seems to be the most popular of the
Yes.
choices.
Some also answer E.
Yeah, it's actually D or E. So this next grouping of slides, we're going to look at the impact of aging on performance. The men are shown by the purple triangles in this figure. The women are shown by the green squares in the figure. As you look at males for the 10-kilometer race, there's not really a drop off between the scores in 20 until you get above that 50 or 60 years of age. In contrast, if you look at the 100-meter dash for the US record, that drop off happens somewhere around the age of 30. For women, the age-related drop in the record time actually begins to manifest somewhere in the age 40 to 50, so a little bit earlier than it does for men. And similarly, for the 100-meter race, the women start to show the age-related drop once they get into the 30s. And then after they hit menopause, then there's a shift in the slope of the curve and a more rapid curve. A lot of this is the difference between the two forms of exercise. When you look at the 100-meter dash, the type of muscle that is involved in the 100-meter dash is mostly the fast twitch muscle. In contrast, for the 10-kilometer, the type of muscle that is involved is the slow twitch muscle. Data like this is used to provide evidence that the fast twitch muscle shows a much earlier age-related decline in function than does the slow twitch muscle. So the second half of the talk is going to focus on adaptations to exercise training with aging. What is the impact of aging on exercise performance, and how can we take advantage of that to diminish the age-related loss in function? So as you look at the strength change with aging, it's no real surprise. The maximal strength decreases. Similarly, there's a drop in the muscle mass, and within that muscle mass, the percentage of slow twitch muscle fiber increases. That means the fast twitch muscle fibers were decreasing at a more rapid rate than the slow twitch. So the total number and size of the muscle fibers decreases, especially the type 2 fibers, which is your fast twitch muscles. Not related to muscles, the nervous system response also slows with aging. In spite of all those changes, there's little change in the oxidative enzyme capacity or the number of capillaries. So the muscles are still able to generate ATP and have the blood flow, the blood supply that they did originally. So how are you going to take advantage of that information in order to recommend an exercise pattern? The type of activity that should be focused on to try and diminish the age-related change is one or more of the cardiovascular endurance exercises. The frequency, how often do you have to do it? It should be 3 to 5 days per week or more, but at least 3 to 5 days per week. The duration, at least 20 to 30 minutes at the appropriate intensity is optimal in order to get the benefits of exercise. The intensity generally is at least 60% of the VO2 max, although this varies individually and the health benefits can occur at lower levels. So if we look at the risk of disease And for a sedentary individual, we assume that they have 100%. So that's our baseline for the risk of disease. Exercising at a low level cuts that disease risk by 40%. There's some further attenuation in the disease risk as you get up to a high level, where the high level of exercise cuts it by more than half. Take a moment and consider that. If there was a drug that could cut the risk of disease by 40%, it would be a bestseller. Everybody would be on that drug. And yet we don't hear that same kind of advocation for making sure that everybody participates in an exercise regimen. Exercise is massively beneficial. And as physicians, it's important that you be aware of your role in encouraging your patients and yourself to participate in exercise. So as you look at the maximum heart rate, it's usually 220 minus the age. So this would have been for someone who's about 37 years of age, and their heart rate, a person who's working at 80% of their maximum heart rate is working at about 75% of their maximum oxygen consumption. We're asking individuals to work at about 60% of their VO2 max, which is going to be about 75% or so of their maximum heart rate. So when you look at the classifications of exercise intensity, it's based on 20 to 60 minutes of endurance activity. So there are three different ways that you can categorize it. You look at the heart rate maximum, the maximum oxygen conserved, or the perception of the individual as to how hard the exercise was. And then that's on a scale of 1 to 20, then the classification of it. So if you're only working at less than 35% of your maximum heart rate and you're less than 30% of your maximum oxygen uptake, that's considered to be very light exercise, sort of walking slowly. The perceived rating of exertion is usually below 9 on that 20-point scale. As you increase your maximum, you get to a greater percentage of your maximum heart rate. Then you start getting into the approaching half of the VO2 max. And the individuals start to notice that that is exercise. So this would be light walking. Getting up to moderate walking, walking at a fast pace, can get your heart rate up to some 60 to 80% of its maximum, and the VO2 also some 50 to 70% of its maximum. The individuals are now aware that they're doing a higher level of exercise. And then by the time you get up to greater than 90% of your heart rate maximum, you're above 85% of the VO2 max, and the individuals report that as a very heavy exercise level. Usually this cannot be sustained for the 20 minutes that they would like you to do it. So individuals that get up to this level often have to stop the exercise because they've exceeded their aerobic capacity. So what would be the characteristics of an effective exercise program? First, there should be a warm-up and stretching period. The current data shows that the warm-up is much more effective than stretching. Currently, stretching is recommended for after exercise rather than before exercise. Then there should be some form of sustained aerobic activity and endurance exercise. It can be walking at a fast pace, it can be swimming, just something to keep the heart rate at an elevated level. After the exercise is complete, there needs to be a period of cooling down and stretching. The stretching after exercise plays a significant role in diminishing the muscle soreness that often accompanies exercise. So by preventing the muscles from becoming sore, it's much more likely that your patients will participate, will continue to participate in the exercise. Another component of the exercise program is flexibility training through yoga, through some other form of activity where you are stretching muscle groups and joints. Resistance training, where you're picking up weights, even low amounts of weights, are able to significantly diminish the rate at which the muscle loss happens as individuals age. And then if you're going to have an individual do this, it has to be fun. So you look for recreational activities that involve getting the heart rate up into that aerobic range. So since physical activity tends to decline substantially as we age, it's really challenging as a researcher to try and distinguish between the effects of aging and those of reduced physical activity. So as you look at is the change caused because the individual is aging or because they are exercising less? And that's one of the real challenges for doing the impact of exercise and on aging. So these are the changes with age in swimming records. Men are shown in the purple circles, women are shown in the blue squares. And you see for the 100-meter freestyle front crawl, the world record, the 30-year-old is about as good as the 25-year-old. And then once you get up to much above that, you start to get a decrease in the ability to complete the race as quickly. The decrease is gradual. Again, the women will show the loss of fast times a little earlier than will men. By the time you get out to be about 70 years of age, both groups then show a very significant drop off in the speed with which they complete the race. And part of that is due to the loss in muscle mass. Part of that is due to the impact of aging on the muscles themselves, the change in muscle types. In contrast to that relatively gradual decrease in function, this shows the impact of age on the combined lift total for individuals involved in powerlifting. In this case, there is no gradual decline. There's a rather sharp decrease in the total amount that can be picked up in powerlifting competitions. So that individuals who reach their peak somewhere in their late 20s for powerlifting, and then by the time they're 40, it's significantly impaired due to the loss of those fast twitch muscles. So the key points for sports performance and aging, as you look at running, swimming, cycling, they indicate that we're in our prime during our 20s and the early 30s. Some swimmers, however, have seen their best swimming performances in their 40s and the 50s. However, that's more often attributed to improvements in technique rather than the muscle mass. So they improve their technique, their skill, and their endurance, not their muscle mass. The muscle mass is being diminished as they get into their 40s and their 50s. The performance generally declines with aging beyond the prime, mostly due to the decrements in muscle and cardiovascular endurance and strength. So how does aging impact the cardiac and pulmonary systems? One of the early changes with aging is there's a decrease in both the central and the peripheral circulation. Your aerobic capacity decreases about 1% per year. The maximum heart rate decreases as you age. Because of the loss of compliance, the stroke volume also decreases with age. So because you've decreased your heart rate and you've decreased your stroke volume, cardiac output diminishes with age. So we're taking a group of individuals from 25 to 75 years of age, looking at their maximum oxygen consumption, and then assuming that this was the starting value, how much of a change there was from that starting value. So this is 0% change from 20 years. As an individual goes from 25 to 35, there is about a 10% drop in their VO2 max. The next decade of life, there's also about another 10% drop in their VO2 max. There is some gradual diminishing, but in general, by the time they reach 75 years of age, 5 decades, they've lost almost 50% of their VO2 max. So their maximum oxygen consumption is getting diminished by about 10% at a relatively constant rate. So comparing it per unit of body weight might not actually accurately measure the VO2 max because, as I showed in an earlier slide, we tend to gain weight as you age. So the VO2 max per kilogram may not be the best values. Because of this, the research is recommended just to use the percentage change in the total VO2 max in liters per minute rather than normalizing that for body weight. So in looking at studies of older athletes, there are individual differences in the rate of decline with aging. Prior training offers little advantage to endurance capacity later in life unless you stay active. Aging alone may not necessarily decrease the VO2 max. So if you keep the intensity and volume of your training high, the decrease in stroke volume and VO2 max with aging slows, especially between ages of 30 and 50. After the age of 50, the drop in stroke volume and VO2 max begin to accelerate even if you are maintaining your training. So I particularly like this graph. This graph looks at a bunch of individuals. You look at athletes who continue to participate in a high intensity training through 70 years of their life. You look at athletes who, after the age of 30, shift over more to the mild exercise, the fitness, the aerobic types of exercise, instead of the very high intensity. You look at the non-athletes who are trained, the untrained individuals, and then this is the athletes who were in high intensity and they just stopped training completely. What this graph shows that if you stop training completely, you lose the benefits from that high intensity training very quickly. So over the next decade, you get very close to and ultimately catch up with the individuals who never participated in any activity at all. The athletes who participate in fitness training show a much more gradual drop in their function. If you look at the non-athletes and have them participate in the fitness training, by the age 50, there's no real difference between the athletes who had shifted over to fitness training and the non-athletes who had begun the fitness training. This study looks at individuals over 50 years of their lives. So a very good, powerful longitudinal study. It says that if you maintain a high intensity training schedule, you can maintain the high VO2 max much higher than the non-athletes participating in aerobic, and certainly higher than the non-athletes, than the 20-year-old non-athletes. If, however, you stop your training, you're going to have a decline in the VO2 max, which has the biggest change during the first 10 years, and then gradually you will join the curve of the individuals who had never been trained. So the pulmonary changes with aging, as you look at the vital capacity and the forced expiratory volume in 1 second, they decrease linearly with age. Residual volume increases. The total lung capacity, however, remains unchanged. So the residual volume to total lung capacity ratio increases. That means that the air within your lung can't be exchanged as well as when you were 20 years of age. The minute expiratory volume decreases after maturity, and the elasticity in the lung tissue and chest wall decreases. So this loss of compliance actually is the cause of the increase in the residual volume and the decrease in the vital capacity and the forced expiratory volume in 1 second. When you do your spirometry testing in individuals, you have to input their age as well as their gender because of this age-related decline in pulmonary function. If, however, you take an individual and they participate in endurance training, that rate at which the compliance decreases is diminished. So the rate at which they lose their elasticity is diminished. The pulmonary ventilation capabilities of the endurance trained athletes are only slightly decreased with aging. So when you look at the people who sustained that level of high intensity training, they did not show nearly as great an attenuation of their pulmonary function. The arterial oxygen saturation does not decrease during strenuous exercise for normally active older adults. So the gas exchange across the lung does not limit the exercise performance in older individuals. So the limitations in oxygen transport to the muscles and the decreased AVO2 difference are the main causes for the reduced VO2 max in these individuals. So as you look at the maximum heart rate, the equation for measuring maximum heart rate is 220 minus your age. But this estimate is for an average value for a given age. The individual can vary as much as plus or minus 20 beats per minute. So consider my situation. I'm almost 70 years old now. My maximum heart rate with that 220 minus your age is about 150 beats per minute. That means if I'm sitting, resting quietly, and my resting heart rate is about 72 beats per minute, a typical value, I'm already at 50% of my maximum heart rate before I begin any activity at all. So as we look at the impact of aging on the cardiovascular system, the maximum heart rate decreases due to a drop in the sympathetic activity, as well as the changes in cardiac conduction. The speed with which the cardiac impulse travels through the heart is diminished with age, which sets up a possibility, an increased possibility of arrhythmias. The maximum stroke volume decreases due to an increased total peripheral resistance and a drop in the left ventricular contractility. The maximum cardiac output is decreased due to both a drop in the maximum heart rate and the diminished stroke volume. Because of that, the oxygen uptake can be diminished due to reduced blood flow to the active tissues and that reduced maximum cardiac output for trained individuals. So again, we use the age 20 as a starting value for this. So it's percent of maximum at age 20. When we look at heart rate in the black circles, there's a nice linear drop off in the maximum heart rate with age. There's also a drop in the stroke volume due to the loss of compliance of the ventricular system with age. And cardiac output is a reflection both of the heart rate and the stroke volume. So that cardiac output is diminished both because of the drop in stroke volume and the drop in heart rate. The other component to cardiovascular performance is perfusion of the peripheral limbs. So the purple circles show young athletes and the blue squares show middle-aged athletes. When you look at the leg blood flow and the oxygen uptake, young athletes show a much greater leg blood flow in liters per minute than do and greater oxygen uptake because of that than do older individuals. So aging alone might decrease the cardiopulmonary system less than deconditioning that occurs with inactivity, decreased activity, or decreased intensity of training. So if you normalize for both the body composition and the physical activity, the VO2 max decreases only 5%, 2 to 5% per decade, rather than the 10% per decade normally attributed to aging. So it's important to recognize that it is the loss in muscle mass, which is precipitating a lot of this, that once you normalize for the weight-related changes, the VO2 max does not decrease nearly as quickly. So moving on to strength changes with aging. The maximum strength is shown by the drop off in the power, the total weights being able to move by the power lifters decreases, as does the muscle mass decrease. Most of that is due to the percentage of the drop off in the fast twitch muscles, and conversely, an increase in the percentage of the slow twitch muscle fibers. The total number and size of the muscle fibers also decreases. That drop off in muscle mass is accompanied by a slowing down of the nervous system, and there's little change in the mitochondrial oxidative enzymes capacity or the number of capillaries. So when you look at the drop off in strength with aging, we've got the peak knee extension strength in trained men, and up through age 60, there's very little decline in that peak. After the age 60, there is some decline over the next 20 years. In contrast, for untrained men, the drop-off begins to occur at the age 30 and then accelerates over the next decades of life. So again, individuals who maintain the strength training do not show the significant drop-off in performance that's usually associated with aging, and even the 80-year-old who's participating in the strength training has the same muscle mass of a 20-year-old who's not participated in training. So while endurance training does not totally prevent the age-related loss in muscle mass, strength and resistance training can help maintain or increase the muscle fiber cross-sectional area in both men and women as they age. So in terms of the impact of environmental stresses, the capacity to perform normal activity at high altitude is not reduced with aging. So aging may actually provide some protection against the symptoms of acute altitude sickness, like high altitude pulmonary edema. And the ability to adapt to exercise in the heat, however, is reduced due to the reduced sweat production with aging. But individuals who are moved to warm environments can show the same acclimatization to the young as for individuals who are still participating in strength training and fitness training. So for the body composition, how your body fat changes, there's a relatively body fat increase after maturity, tied mostly to both the increase in dietary intake, a decrease in physical activity, and a reduced ability to mobilize fat from the fat stores as you age. After you get to age 30, the fat-free mass decreases mostly due to the loss of muscle mass and the increased mineral loss from the bones. Each of those is tied to a drop in the physical activity. So as you look at the percentage of body fat, you look at young adults, women, 18 to 24 years of age have a greater percentage of body fat than do men. We look at the same groups as they get to 45 to 60 years of age. Both groups have gone up, and the sex-related difference is still maintained. However, when you look at masters athletes, these are athletes continuing to maintain a high level, high intensity training. For swimmers and runners, their percent body fat is no different than the young adult body fat. So training can prevent the accumulation of body fat that is normally associated with the aging process. As clinicians, you have to recognize that the physical training is a great way to offset the age-related changes in body composition. As individuals age, endurance exercise produces similar gains in healthy people regardless of their age, sex, or initial fitness level. It produces greater improvement in the muscle oxidative enzymes than in younger endurance-trained activities, but that's mostly due to a lower initial capacity. Resistance exercises, the weightlifting kind of exercises, they cause increases in muscle strength and muscle hypertrophy, but the amount of the gain is lower than in younger individuals, and a lot of that is tied to the lower testosterone and estrogen levels in individuals who are older. When you look at if you have somebody who says they want to lose weight, and the question is what is better, diet, exercise, or a combination? This graph shows the change in pounds with total body weight in blue, the body fat in orange, and the fat-free mass, which is mostly muscle mass, in purple. So if you diet, you do lose weight. A lot of that weight comes from body fat, but some of that weight loss comes from muscle. Conversely, if you would exercise, you can lose about the same amount of weight, but a much greater drop in the weight due to body fat, and you actually increase the fat-free muscle mass. If you do them both in combination, you get the best drop in body fat and in total body weight. At the same time that the body weight is going down, you're actually increasing the muscle mass, the fat-free body mass. So that takes us through the series of changes to the body that are caused with aging. As I said, my interest in this is personal, not academic. As I age, I'm paying attention to what is going on with my body. I actually did play competitive sports when I was younger, but when I got into my 30s, I stopped exercising as regularly. And in the data that I presented, I participated in some of those studies, and I was in the group that had been aerobically fit and then completely stopped exercising. I'm now back to exercising again, walking strenuously for about 1 hour each day in order to maintain a level of fitness. So as an aging physiologist, the take-home message for the talk is growing older is better than not growing older. And with that, terima kasih, apakah Anda punya pertanyaan?
Okay, terima kasih, Prof. Thank you very much, Prof. Carroll. I hope you all enjoy these amazing presentations like I do. We arrive in the question and answer session. Before we start the question from the audience, Prof, if you have a question for the books giveaway, Prof. Can you ask one question for all the participants?
Right.
Okay.
I wish I thought about it earlier. I didn't realize I was supposed to come up with it right now. For an essay question, it would be what type of exercise would be most useful and for decreasing the age-related loss in muscle performance, and why?
Okay, can you repeat
Sure.
once more?
What type of exercise would be most effective for diminishing the age-related loss in muscle function, and why would it be effective? So what is the mechanism for its action?
Okay. The question is, what type of exercise you think is most effective for diminishing age-related loss of muscle function? Is that right, Prof?
Yes.
Oh, one of the students is already raised hand. Hisham, please.
Okay, thank you, Prof, for the opportunity. I want what type exercise to diminishing of a muscle. I think the best exercise is endurance training, like a gym, it's like a gym taking a barbell or weightlifting or biceps curl and something to make your biceps or a muscle to be more stronger. I think that's the reason why it's the best to increase the muscle fiber for aging.
Yes. So
There's one more answer, Prof, from Rana. Rana, please.
Thank you for the opportunity. From myself, I think the best exercise to maintain muscle fiber is strength or resistance training. Because I think when we do strength related, like for example, barbell, it maintains our muscle mass more than endurance training. Because I think endurance training is more related to heartbeat strength instead of muscle mass. But I think their combination between both training might be best. I think that's all from me. Thank you.
So we have two different answers, Prof. One
Yes.
is answering endurance training, and the second one is train.
right. And Rana's answer is the one that is closest, is the best of the two, because it is the resistance type of exercise, which is one that produces, which helps you maintain the muscle strength and the muscle.
Okay, the resistance, so is it
Yes.
closest to the
Rana had the
endurance? Oh,
closest
Rana.
answer.
Okay.
Yes.
Okay,
Okay,
congratulations.
so the books is belong to Rana. Now we begin question and answer sessions. If any of the participants have questions, you can raise your hand and unmute yourself. I also invite the teachers and residents from obstetric and gynecology department to ask questions. If there are any question, you can raise your hand. The first question is from Muzaffar, please.
Okay, thank you, Dr. Raisa, for the opportunity. Let me introduce myself. My name is Muzaffar Rahman. I'm from Beta class. I want to ask to Prof. Robert Carroll. Which one do you prefer or better if we take 1 hour exercise but only in weekend, but or exercise every day but only 15 minutes? What prefer better, Prof?
Sure. The data that I've seen has said that it's the total amount of exercise per week. So there wouldn't really be much difference between 60 minutes of one activity and then 10 minutes 6 times a day. If you would go up to 20 minutes a day, then that would be better than just once on the weekend. But it's the total activity over the course of the week, which is good. But for the cardiovascular benefits, it should be sustained for 20 minutes at least 3 times a week.
Thank you, Prof.
Do you have any other comment, Muzaffar? Enough?
Maybe enough, Doc.
So you have to add 10 more minutes per day. Dr. Irfan, please.
Okay, thank you, Prof. Thank you, for Robert, for very nice presentation and insightful inside our way of thinking about the aging. So I have one question that it's still debate among our medical college about how to prevent the effect of the aging, especially about the hormonal therapy, hormonal treatment that some of our physiologists believe that hormonal treatment is very dangerous because it's opposite to the physiological process of aging and will increase the risk of the carcinoma or cancer. But some believe that it's still useful for maintains the physiological process of aging. So my question is, based on your experience and based on your knowledge, that do we have to still still give the replacement treatment, hormone replacement treatment to, especially for women, for women already menopause, because the menopause have some bad symptom for menopause that is not suitable for the woman, and
Right.
some of doctor give the hormonal for this treatment. Thank you, Prof.
Sure. And that's a great question because the data is all over the place. There's not a consensus as to what the best approach is. Estrogen for sure is protective for the cardiovascular system. So the hormone replacement therapy for postmenopausal women where estrogen is being used does help diminish the cardiovascular diseases. There are a number of cancers that are responsive to hormones. So breast cancer, estrogen, the estrogen that will stimulate the growth of those cancers. So I've not seen the epidemiological results from that, but I know even in the US, there's significant discussion and research trying to figure out what the appropriate stance is, whether both for males and females, whether the hormone replacement therapies yield a benefit or do they set you up for liver disease, for other diseases later on. So unfortunately, there's no good answer for that one, Prof. Irfan.
Okay. So there is still a debate on that.
Yes, there
Professor. Yes.
is.
Thank you, Prof.
Yeah. Thank you,
Dr.
Prof,
Rai?
for the answer. Yes.
Dr. Raisa?
Yes, Prof. Hardy. Please.
Thank you, Dr. Raisa and Dr. Irfan. Thank you, Bob, Dr. Bob, Professor Bob Carroll, for your excellent lectures. Concerning Dr. Irfan's questions, I would like to ask you, what about using the BRHC, bioidentical hormone replacement therapy, might be widely used in the A4M, and also in the functional medicine, we are using the hormone directly, but we try to find the cause of the hormonal insufficiency. So in order to correct the dysfunctional, physiological dysfunctional, is much better than that. Instead of the hormone replacement therapy, but try to find what is the cause. What they call it as a tolocalsum. Thank you.
That is far beyond the area that I'm familiar with. So Prof. Hardy, what is your sense of what the right approach is?
Usually in my practice, I use the BRHT, but before using this treatment, replacement therapy, I used to check the biomarkers lab, the lab biomarkers of the hormones. But in the functional medicine, it's a different time. They are not really suggesting using the hormone replacement therapy, but try to find the cause of the hormonal deficiency.
For some of the hormonal deficiencies, and now we'll talk about men, there's a lot of work, a lot of interest here on human growth hormone to try and preserve the muscle mass. And there's a significant benefit to having that amount of muscle mass. What they haven't come to grips with is all of the insulin-like growth factors and the other components that the human growth hormone works through. So it's really from the physiologist research side of things, it's pretty much a mess. They don't have a good sense of how to do it. So finding ways to preserve individual organ functions and diminishing the harmful consequences of the drop of the diminished hormone would be one way to approach it.
Yeah, that's right, Dr. Carroll. I think it's better back to the basic of physiology. Yeah.
Yes.
Thank you.
Thank you, Prof. Hardy. So it is so interesting. We therapy and also bioidentical hormonal therapy. So we know that humans nowadays is working to do something with this, with aging. For all participants, do you have any other questions? Yes, Dafa Rafid, please.
Okay, thank you so much for the opportunity. So I'm gonna ask to Professor. So I've ever heard that a good behavior can prevent aging. So I wanna ask you a question, Prof. Can diet prevent aging, Prof? Thank you very much.
From all of the approaches that have been used, diet is by far the most effective. But it is a significant diet. It's like 80% of the ad lib calories, but you can improve lifespan, and this is humans and animals, dramatically. So most of the common denominator for all the diet studies and the other approaches that have been used seem to be the free radical production. If you can limit the free radical production by the mitochondria, that will reduce the age-related damage, and caloric restriction is one way to reduce that free radical production.
Yeah, so diet is the most effective lifestyle, I think, and it's modifiable. So we have to taking more notes to what we eat and what we consume. Do you have any
I think
other
it's enough. Thank you
comments,
so much,
Dafa?
Prof, for the answer.
Rosalie Dorothy, please.
Thank you for the opportunity. I would like to ask Professor Carroll. I've heard about the blue zones, where in that zones, a lot of people reach a higher average lifespan than the most of the world. I would like to ask what kind of lifestyle do they usually lead, or whether there's any psychological effects to the aging parts, Professor.
Okay. Generally, the areas with the greatest longevity, it's a very low or a fairly low protein intake. The often vegetarian proteins rather than animal proteins. Now, the physiologist in me says you break it down to amino acids anyway. So the difference between an animal protein and a vegetable protein has to be more tied to quantity rather than the impact. But the areas with low caloric intake, high lifestyle, physical activity, a lot of walking, things like that, those seem to be the commonalities among the areas that have the extended lifespan.
I see. Thank you, Professor.
Thank you, Rosalie, for the questions. Is there any other questions? Yes, Tasiwani, please.
Okay, thank you for the opportunity, Dr. Raisa and Professor Robert Carroll. Let me introduce myself. My name is Tasiwani Yuna. I want to ask a question. So I saw the news on television. There was a woman who was 15 years old, but she is still look as young as 25 or 20 years old. While for some women of the same age, even though they already did some good lifestyle, but I'm sorry. Okay. While for some women of the same age have experienced significant physical change on their face, maybe. My question is, what is the physiological mechanism that occurs in that woman? Is that a normal or not? Thank you, Professor.
Thank you for the question, Taswami. The changes, and now I have to go to the US. exposure to sunlight causes a significant aging effect on the skin. So in the US, individuals who work outdoors, who spend a large amount of their life outdoors, generally have a much more, it's termed a weathered face in our culture, and show the effects of the ultraviolet light damage to the skin. It's impossible to downplay the role of genetics. Some people got lucky in the gene pool and their face will, and their bodies will not show the aging process. So when you look at a lot of in the US, the models, their skin, their face doesn't look that much different than 30 or 40 years ago. That's genetics and a lot of skincare product. But the role of genetics predisposes you to not showing aging, and then avoiding the sunlight, avoiding the stressors that can induce aging would be the other half of the equation.
Yeah, that's also interesting for me. Because some women also mentions about reversing aging, Prof. So lots of skin cares and
Now, I tend to be suspicious of anybody who's trying to get my money into their pocket by giving me something. So when someone says, I have this and it is wonderful, I tend to not believe it. And it's sort of like the cosmetics where you have some of the models who go, oh yes, I use this and my skin has not aged at all. And I sort of, yeah, but if you didn't use it, your skin wouldn't have aged at all anyway. So I prefer the controlled studies before making a conclusion.
So there's no such word like reverse aging.
A lot of it is just skin hydration. So when you get to be 60, 70 years of age, dehydration plays a significant role. So agents that can dissolve in the skin and increase hydration for a couple hours will make the skin appear more youthful. But for a couple of hours, I don't consider that the net gain.
Okay, very interesting, Prof. We still have 20 minutes. If there are any other questions, you can raise hands.
Prof, I have one question. That in Indonesia, I believe also in United States, there are a lot of dermatologist clinic who serve to prevent the aging, especially in the skin. As we know that skin cell is a kind of mitosis cell, ongoing mitosis cell. So which means that the cell will be replaced after several times, several months. Gitu. So some dermatologist clinics has several variation treatment to make a skin replace it earlier, and then they have a new skin, another new skin.
Yes.
Some believes that so with this treatment, the skin is still young, always replace it with a young one. So what my question is, I believe in, is there any data or experience in your country that is it really effective if someone always come to this kind of clinic to make their skin still smooth
Okay.
until several years? Thank you.
Yes. Thank you for the question. I'm not sure how many times it can be done. Because I've got some actinic keratoses. I've been treated with the fluorouracil a couple times. And that drug is the equivalent of a chemical face peel. And I may not have an appreciation for what young skin looks like, but my wife assures me that my skin looked much younger after I completed the treatment. And I lost a couple layers of skin. It took a couple layers off. And so there are good, healthy, young appearing cells underneath the superficial layers on the skin. I'm on a schedule where I do that once a year. Now, whether you can try and do it more frequently, I'm not sure that it would be beneficial. I'm much more comfortable saying I'm getting older. I'm supposed to look like I'm getting older. I've earned every one of my wrinkles.
Okay, thank you, Rob.
Yeah.
Okay, Raisa, kalau
Okay,
ada lagi.
Tiara, you can deliver your questions, please.
Okay, thank you for the opportunity, Dr. Raisa and Prof. Carroll. My name is Tiara, and I would ask something. As Tesiwani's question earlier, there are several people who are the same age but look younger. Besides that, diet and exercise, is there declining the fact that being older also impact to our body? Thank you.
Could you repeat the question? I missed the last part of it.
Is it beside dieting and exercise, is it the mindset of rejecting that getting older? Is it impact to the body?
I tend to think that the mindset is going to contribute to how well you adhere to the exercise and the diet regimens. But in terms of the appearance, I'm going to fall back on genetics. And I've got two daughters. The one who is 31 years of age can pass for 18 or 19. And the one who's 29 years of age looks 29 years old. So on my mother's side of the family, the women age very well and look very young when they're in their 60s and 70s. And for our side of the family, or for my family, one of my daughters takes after my mother's side, one of them takes after my father's side. So one looks much younger than the other, even though they're close in age. So I don't think that attitude is going to play a big role. Start with genetics, and then how well you adhere to the lifestyle and exercise would be the major impactors. Dr. Rice, I can't hear you.
Sorry, Prof.
Okay.
Okay. Something is wrong with the microphone of the main host. Prof. Hardy is raising his hand. Please, Prof.
Thank you very much, Professor Carroll and Dr. Irfan and Dr. Raisa. Dr. Irfan already raised good questions about these aesthetic problems in the dermatology clinics. And also Dr. Raisa raised about the reverse anti-aging. I do agree with your lectures, Dr. Professor Carroll. You mentioned about the main problem is the aging physiology, but the genetics also is the main problem. And besides that, there is the epigenetics, the lifestyle behavior is very important, like stress, relaxation, nutrition, stress management, and relationship, and also the other things. Also the epigenetics. So concerning about the cases that Dr. Reza mentioned about the ladies who is more than 50 but look younger, he used this, what they call it, the epigenetics, and also in diet, exercise, relaxation, nutrition, and so on. The diet is not only the restriction of diet, but we call it the harmony balanced diet. You can see the cases in America about Arnold Schwarzenegger, the actor and the governors. He's a bodybuilder. He used a lot of anabolic steroid hormone before Dr. Irfan. But now you can see his pictures. He's getting very old.
Right.
Some mention about the very high impact exercise that cause the what we call the mTOR that make him aging. The Arnold Schwarzenegger. What is your comment about that?
Most of the changes that I think the young bodybuilders did were tied to anabolic steroids. So getting, I think he might have gotten away from those early enough in his life that it did not have the truly harmful effects. In contrast, there's another actor, Sylvester Stallone. He played in Rocky movies. He is abusing growth hormone, and as you look at his pictures now, he's developing acromegaly from the excessive high levels of growth hormone. And there's not a quick hormonal intervention that is going to diminish aging. Unfortunately, it is the long-term diet and exercise lifestyle rather than something that can be found off the shelf that will slow down the aging process.
Okay, thank you. Carol.
Thank you, Prof. Hardy. We have one more question from Surya.
Thank you, Dr. Reza.
Yes.
I'm sorry, I cannot
Apa
open
kabar,
my
Dr. Adrianta?
video. But, and also I
Okay.
use Surya
Prof.
before. I
Adrianta.
didn't realize I have to use my Adrianta name, but Surya is my last name. Okay, so Rob, nice lecture for us to have a good overview about aging. What about now the theory of telomerase? telomere. That's in our DNA. There is a telomere, and they prevent shortening. The theory is to prevent shortening, then you get better old age. What do you think about that?
No,
Thank you.
thanks, Adriata. There's good evidence that the telomere shortening sets up the maximum number of generations that a cell can go through. And there's some thought that there is a limited number of generations because you lose a little bit of the telomere with each successive generation of the cells. How that figures into the overall aging process, that works well in the cell culture setup. How it plays out in the intact organism is still up for grabs because you've got cells like the GI epithelia, skin cells that replicate thousands of times from the stems, beginning from the stem cell. And so the telomere shortening does not seem to set the upper limit on all cells being able to replicate. But again, a good question in a very active area of research.
Yeah, maybe coming research will prove it or disprove it.
Yes.
But that's nice that they go to more molecular things now in physiology and the mechanism of those small, or what is that, biomolecular things. We need also do more research. Comment about the skin. I think all those clinics really have done some help. Otherwise, they will not be in the market. So I think there is some help for the skin care for women, especially. They always like to have beauty skin. So, and not just giving hormones, but other things. I think maybe just skincare or dehydration of the skin that is important, and give serum, give vitamin C. That's all they give maybe. So if you go to such clinic, the women, I think they will get a good skin. No doubt. Also now there are pharmaceuticals and nutraceuticals that they are trying to use to get a better skin. And I think I believe that. Yeah, you cannot over believe, but there is some benefit. Some women has great benefit. Some doesn't have, but you should try. But don't try always the most expensive one. And now everything goes from America to Indonesia to get so much multi-level marketing from USA, and you said it's good, but you have to watch it and maybe try it. But some I think is beneficial. So there must be, of course, some research for that. Yes. So
yes.
Also Prof. Hardy said about hormones. Now for male, testosterone is certainly you have to measure testosterone in older male, and you can give it so that your muscle also don't decrease so much. Because for us, sarcopenia is a big thing, because we get older and then we get sarcopenia, you get weight loss, and then you can fall, and yet you can get fractures. So that's not good. So testosterone is a good hormone for male also, not only for erection problems, but for your muscle also very good. So I think we have really to look very carefully for new things, but some basic things, if it's proven, like your talk about hormone levels in the aging, it's good. But for estrogen, to give it, still debate because it can cause to cancer. But maybe later, when they have good pharmaceuticals, nutraceuticals, that is not as estrogen hormone, but like replace what is that estrogen from plants, maybe will be better than estrogen in the drug form. So I think with this aging subject or topic, there is a lot of research that coming up because everybody likes to reduce the aging process. Yes, everybody likes it. And if we can do it, why not? But not to be old and you cannot do anything. That's not good at all. You maybe know Prof. Sudarsa from Physiology in Surabaya. He is very, still very good shape. He can do most of the things, and he is over 90. And we have another dean in Surabaya, the oldest dean in the world, I think. Prof. Maramis is 90-something years and still a dean. So aging is a good topic for all of us. Thank you for the nice lecture. Thank you, Dr. Risa and Dr. Eva.
Thank you, Prof. Adrian. Prof. Hardy, do you have?
All right, Dr. Risa. Thank you very much. Anti-aging is aging physiology is very hot topic now. And other disciplines also, and clinical sciences also, they try to learn about integrated anti-aging, aging physiology. So we are good lecture, Prof. Carroll, about that. About telomeres, this already having a lot of research in America. Dr. Elizabeth Blackburn, who got a Nobel Prize in telomerasis, shortening of the telomeres is concerning with the delayed aging process. And there are a lot of drugs they use for to stimulate this lengthening of the telomeres, what do you call it, the astragalus TA.
Right.
I got it from America, a lot of this. Concerning about this testosterone, I do agree with Dr. Adurenta. Testosterone also is good, not only for the sexual function, but also for the metabolism. Like in diabetes, we use testosterone that it will help the metabolism of the glucose. Just additional information. Thank you very much, Dr. Reza and Prof. Carroll.
Thank you, Prof. Hardy.
Thank you, Prof. Hardy.
To Prof. Adrianta, do you still have? Oh no, he's lowering his hand. So we still have questions, Prof. From Vivi Sugiharto first. Please, Vivi.
Prof. Robert Carroll. So my name is Vivi. So I want to ask a question related to things that affect aging. From the explanation, it was stated that diet and genetics have significant impact in age. What about sleep? Does it also affect the aging process?
I think the quality of sleep affects the endocrine system. So if you are not getting a good quality sleep, the body interprets that as a stress. Your cortisol levels go up. All the other stress hormone levels go up. And so there is a diminished sleep quality that goes along with aging. And that then magnifies the other changes that are happening. So if you can sleep well, the stress on the body is diminished, and then that will blunt the aging process. I'm much more conscious now about my sleep habits and making sure I get into a very dark room in order to get a good night's sleep. And I track the cycles, how many times in the night I wake up, and try and make sure that I'm getting enough of the REM sleep to nurture my body. So yeah, there's a disruption in sleep that happens as you age, and the more you can do to preserve good sleep behaviors, the better served you'll be.
Thank you so much, Professor, for the answer.
Yeah, thank you, Vivi. The question from Anur Wahid.
Thank you for the opportunity, Prof. and Dr. Aisa. I just want to ask, one day, I want to go to beach with my friends, such like refreshing from my boarding school. So I met a couple person that it might be not from Indonesia. So he asked me, "How old are you?" And I say 17. And he was look like, "No, you're not 17." And that time, it's very bothering my mind. Like maybe there is some picture from not our inside, but from our outside, like temperature, UV, or some weather, or maybe climate that maybe have impact for aging to someone. That's my question. Thank you, Prof.
Okay. So, yeah, we keep coming back to a similar theme that you start off with the genetics, and then it's the epigenetic component, as Prof. Hardy had said. It's the lifestyle, the environmental exposures. As soon as you cross cultures, then the judging age becomes much more challenging. I'm not sure if the people who you ran into were also Indonesian, but so much of aging is related to the personal experience and who you're exposed to and the judging of how old individuals are, that once you cross cultures, the norms go away completely, and what you try and relate to as you think of age becomes much more challenging.
Yeah. Anur, do you have anything to add?
No, Doctor. Thank you, Prof.
Thank you, Anur. Is there any other questions? Again, I also invite lecturer and resident from obstetric and gynecology department. I see Dr. Ferry. Is there any comment or questions, Doctor? Dr. Irfan wants to add something for us. Please, Dr. Irfan.
Okay, I think it is very interesting topic, and Prof, I do believe that your lecture will be needed more in the next moments. So please do not hesitate to help us to give your experience, your lecture, and for our next student. And we do plan that this insightful moment will be continue for next years. For next year, so which means that we still hope that you are willing to give us a lecture in another moment. And for everyone, I would like to say thank you, especially for my student. And I hope that you can elaborate this knowledge to your last lecture or to your last material that you have been learned from PBL, from TBL with Prof Nori, and also from the lecture with our staff member. And on behalf of our faculty, I would like to say thank you very much for Professor Robert G. Carroll, that I hope that on the next moment we can meet not in online, but we can meet directly to Rob Carroll in Indonesia or in another opportunity. Maybe one of you next can become a physiologist and can meet Prof. Carroll in the future IUPS meeting or APS meeting, Prof. I hope that one of our students can be also a physiologist. I think that's all for this moment. Thank you very much, Professor Robert J. Carroll, Prof. Hardarmawan, Professor Ardianta, and Dr. Aisa for this very useful moments, and to Dr. Ferry and team members in Department of Obstetric and Gynecology. Thank you for your participation. And for other members of physiologists in the Indonesian Physiological Society, and if you want to re-watch again this college, these lectures, so you can use YouTube, yeah. We will share the link of YouTube after that. Thank you very much, Professor Robert. Hope that we can meet again.
It was my pleasure, Prof. You're fun. Thank you, Dr. Aisa, for hosting the gathering.
Thank you, Prof. Carroll. So we come to the end of this session. I hope and I'm sure this presentation is very beneficial for all of us. It was a pleasure to have Prof. Carroll with us today. Please give applause for Prof. Robert Carroll and for all of us, for all the active participants. Have a nice day and see you again in person someday.
Hopefully.
Thank you. Makasih, Bro.
Bye-bye.
Bye-bye.
Thank you.